Okay, now I'm going to show you something special. We all know about all the people who are having hip replacements for one reason or another. I'll tell you a little story about a lady at my synagogue who had been having trouble with her hip, and she went to a surgeon, and he said, well, you need a hip replacement. She happened to mention this to me casually, and I said, well, has you ever tried reverse triangle? She'd been a yoga student, and she knew what, had an idea what that was. I said, no. Long story short, she did reverse triangle for a few weeks. The hip problem cleared up, and she never had to have a hip replacement. So I'm going to show you this movement, and if you or any of your friends start having trouble with your hip, you may be able to remedy it with this movement. Basically what it does is it stabilizes and strengthens the hip. Okay, so here's how it works. I need a little room. I think everybody knows what triangle pose is in yoga. Something like this. That's not what I'm going to teach you right now. It's going to be what we call reverse triangle, where you're going the opposite direction. The left foot is bent, pointing to the side. The right foot is pointing forward. You're putting weight on that right foot, and, well, you're putting it on the side where the hip is bothering you. In this case, I'm assuming the hip problem is on your right hip. So what we're going to do is we're going to do the movement this way. Of course, it would be the opposite if it were the left hip that was bothering you. So I'm going to come into the movement. It's a difficult movement to do. Bend that left leg. Push the right leg. Make it perfectly straight. Put the weight on the outside. And reach back like so. Reach down with the right arm. Reach over with the left arm. Bend the left leg. Reach back, reach back, reach back. Like this. Try to maintain that for about 15 or 20 seconds, or longer if you can. I do this every couple of months when I have trouble with my hip, and it fixes it. Okay. Good. Try to bend the left leg a little bit more. Try to keep this one a little straighter. Put the weight back here on the outside. Press. The deeper you can go with the left leg, the more extension you'll get with the right. You can also reach down with that right hand while you're doing it. Reach down. There you go. Feel it? Can you bend a little bit more on that left leg? There you go. Very good. Okay. Very good. Okay, so there's three exercises I can recommend for the knee. One is sitting on a bench, putting an ankle weight on your foot of maybe 5 pounds, something like that, and extending your foot straight up like so, slowly, 10 times. And then you do it with the other foot. Repeat that again. And then when you finish that, you have the ankle weight on your foot, and you stand and you raise your foot backwards like so. Again, they have these equipment in the gyms that have the ability to adjust the weight on the resistance. But you can do it, you can get a little ankle weight and do it at home too. So you do that on each side. And then, again, you repeat again, second set, so to speak, repetition of the same thing. The last thing I'm going to recommend, well, two other things. A deep knee bend, a squat, half squat, where you go down like so. You put your feet out. I better use the mat so I don't slip because I'm wearing this sock. This is the last exercise I recommend for the knee, strengthening the knee. You basically come down into a half squat. Make sure your knees don't go over your feet. Okay? It should be about level with it, but not past your feet. You come down, you wait a couple seconds, and you come back up. Like so. Theoretically, you can do this without the wall, but it's a lot harder to do. Do that 10 times. If and when you feel pain going down, you stop at the point of pain, you come back up, you wait 6 or 7 seconds, and you come down again. It's very slow, gradual movements. Chances are you'll be able to get past that point of pain that you initially had. Again, don't try to push through the pain. Just if you feel it, like when you get to this point, you stop, you come back up, you wait, and you try it again. You stay down in that position, 4 or 5 seconds, come back up, do that 10 times. Also, walking steps is good for the knee. If you want to do the squat, your feet should be out further. More like that. Okay, try it. Feet are too close in. Your knees are way past your feet. Move your feet further out. Try it again. That's about right. This is much easier to do when you have a smooth wall. Try to go an inch or two lower the next time. Right, that's good enough. Yeah. More than necessary. Okay, very good.